You've probably heard that everybody needs a colonoscopy at age 45, but is that really true? What if you're younger? What if you have a family history of colon cancer? And are there situations where you might not need one at all? As a gastroenterologist, I'm going to go over exactly who needs a colonoscopy, when to get one, and why these recommendations have changed. So why does colonoscopy matter? Colon cancer is one of the most preventable cancers. Colonoscopy can find precancerous polyps, which are little growths that grow in the colon. It is these polyps that eventually, over years and years and years, can grow to become colon cancer. The advantage of colonoscopy is that polyps can be removed before the development of colon cancer. So why does screening colonoscopy start at age 45? It used to start at age 50, but there are colon cancer rates rising in young adults. Guidelines now recommend screening colonoscopy for average risk individuals at age 45. So who is average risk for colon cancer? That is someone that does not have a personal history of colon polyps, has no personal history of colon cancer, no history of inflammatory bowel disease, or no strong family history of colon cancer. So for most people, you could start screening at age 45. So who needs to start screening earlier? Someone with a strong family history of colon cancer. That can include a parent or a sibling with colon cancer or multiple relatives with colon cancer. Some of my patients have genetic conditions which cause them to be at increased risk for colon cancer, and they will start colonoscopy sooner than age 45. That can include hereditary disorders such as Lynch syndrome or familial adenomatous polyposis. Patients with inflammatory bowel disease, such as ulcerative colitis and Crohn's disease, also may start screening earlier. These patients that I just described often start screening much earlier. So do you always need a colonoscopy? There are different screening options besides colonoscopy, which include stool-based testing. I always tell my patients the best test for screening is the one that actually gets done. But I also remind them that colonoscopy is a most comprehensive test and is meant to find not only colon cancer, but colon polyps as well, and removing those polyps to prevent the development of colon cancer, while many of the other non-invasive or stool-based testing is focused on finding a colon cancer. But when I take into account most of the colonoscopies that I do, it's frequently colon polyps which are found and not colon cancer. It's important to note that symptoms change everything. Even if you're younger than 45, evaluation may be needed for bloody bowel movements, iron deficiency anemia, unexpected weight loss, or persistent bowel habit changes. So what are some common colonoscopy myths? Myth number one is that it's too painful, but the reality is that most patients are sedated for the procedure and don't even remember having the procedure done. Myth number two is that I'm too young. The reality is that young adults can still develop colon cancer. Myth number three is that if I feel fine, I don't need to be screened. But the reality is that polyps rarely cause symptoms, but if they're not removed, they can grow to become colon cancer. So to summarize, most adults need to start screening at age 45. They need to start earlier if they're higher risk. Symptoms may require evaluation regardless of age, and colonoscopy can prevent cancer before it starts. So how old were you when you had your first colonoscopy? Let me know in the comments. And if you found this helpful, subscribe for more GI and digestive health information. Take care.